is Jonathan here at Kalkstein Chiropractic, your Baltimore area chiropractor. Today we have a cool case. This is Sam.
Hi.
She's coming in with migraines. She's been dealing with migraines for quite a while now, right?
Mm-hmm. Since I was around 4 years old, I've been having migraines.
Oh man, that is a long time.
Yeah.
So she gets kind of the classic migraines where you get migraines with aura or without aura. And aura just explains, a lot of people think just like light sensitivity or photophobia. She also gets a little bit of a nauseous type of symptoms, as well as like it affects her daily activities. Would you agree with that?
Yep, definitely.
And there's 3 types. So you have, it could be location-wise frontal, it could be ocular or even temporal. And yours is ocular, behind your eye.
Yep.
Right?
Right behind my eyebrow right here.
And then when they do flare up, would you say like the duration of it between hours to days, or more just hours?
Typically if it's like a severe migraine, it'll last usually 2 days. It'll be like slightly less severe the next day, but it's still there. But just like an annoying headache will typically just last the day, and then by the time I wake up the next morning, it's gone. So.
Perfect. So that's classic time duration of a migraine. Any longer would be almost like a red flag that we would try to dive into her history and do further examinations. Also, a little snippet about migraines as far as diagnosing them. Typically, you want to be, the patient should have migraines that last up to 72 hours, that 2-day mark that you mentioned, for 5 episodic events during that 1 month. And you pretty frequently get them.
Mm-hmm.
Would you say you get them less now since starting treatment?
Definitely, yeah.
Awesome.
I usually was having probably 5 to 10 a month, and now I'm probably only having 2 to 3 a month.
Nice.
Yeah, like severe migraines.
That's awesome to hear.
Yeah.
So I'll put her chart down and explain while we treat. So I'm going to start with some soft tissue work. So if you want to pull the chair a little bit away from that wall. So the reason we do soft tissue is because some of these structures in her neck can correlate with flare-ups in her migraine. So the structures that we're talking about could be her suboccipitals up high, could be her SCMs in the front, her scalenes. So you've been coming in for almost about a month, I feel like now.
Yeah.
And so treatment of care has included with dry needling being the best passive thing that we've been doing with her. Dry needles, I'm sure if you guys have seen our other videos, lean back for me please. That is one of our most powerful modalities in-house. And those of you who do not know what dry needling is, it is a tool that we use very similar to acupuncture, but different insertions. So the whole point of dry needle is to inhibit these muscles, to turn off, so that the inflammatory process can start, expediting the healing process of these tissues, because sometimes tissues are all coiled up and they don't glide when they should glide like this. And so we've hit a mark with Sam that her tissues are less tonic, less tight per se, and we're now getting into more active care. So some studies have shown that increasing exercises to strengthen certain structures and stretch others could really help with decreasing the flare-ups and the migraines. So that's why we tend to go more active care right after the passive. You feel that, Sam?
Oh, yeah.
So that's a little trigger point. Is that referring anywhere when I push on it?
No.
Okay, good. So you're going to look up to the ceiling. You're going to look down as far as you can go, and then slightly to your left. So right now we're doing a pin and stretch technique. I'm going to just repeat that look up, called ART, active release technique. Basically pinning that muscle, shortening it when she looks up. And then when she looks down, she's elongating it, but I'm pinning it with my thumb. And how does that feel, Sam?
It hurts.
It's almost like a love-hate relationship with these, where more hate during, love after.
Yeah.
So we're going to do the other side now.
Okay.
And shout out to Huns Honey for providing our cream for all the soft tissue things that we do in-house. And you are a student, right?
Yes.
At Towson?
Yeah, I'm a junior this year.
Hey!
Yeah.
And what are you studying?
I study marketing.
Awesome. What do you want to do with that?
I don't know. I honestly have no idea. I'm still trying to feel it out, figure out what I like the best.
Sure.
Hopefully I'll figure it out soon.
Oh, you will. You have time. You are so young.
Yeah.
So same thing this side. Look up. Look all the way down. And then, yeah, good job. Keep that chin down as best as you can. And then back up. And then back down. So also the reason we treat necks or focus on her neck with migraine complaints is that 75% of patients usually with migraines report some sort of neck pain, which we have to address and make sure that is appropriate for these types of treatments that we're doing for her. One more. Up and down. So migraines can also elicit and be red flags depending on the population. Generally people 50 or older usually won't present with a new onset of a migraine. If they do, that's almost a red flag that we have to rule other things out, like what is called giant cell arteritis, where basically this vessel is not working and pops and can lead to other complications not good. So that's why we have to rule out really big complications like a stroke, very similar things that could happen that Sam reports: migraines, ocular pain, nausea, dizziness. The difference between the two, typical migraines like Sam's here will be a slow onset of getting to that point of flared up, rather than a stroke or a dissecting vertebral artery that runs from your spine up to your brain will be very quick onset, be very, very painful. Like if you ever experience a migraine, but a different type of migraine than you have experienced, that's also a red flag. So if that ever happens, come in and just let us know.
Got it.
So why don't we come to the table, please? We're gonna lay face down first. So in addition to Sam's migraines and neck pain, she also has a few restrictions in her spine because she's a student. You know, she studies a lot. She's active as well. She's on a dance team in her sorority. And so we address these areas with the adjustments. So she's stuck there. And then, how's your low back been feeling?
It's been a little tight recently.
So we've been adjusting segments in our low back, mid back, and neck. So we're gonna start here. Right here. So big breath in. Another big breath in. Let that fall. Good job. You okay with that?
Mm-hmm.
Checking her CT junction, and all you guys that follow our videos know all about that CT junction where the neck meets that thoracic. Any student will always have a little tight junction area right here. So turn your head to your right, please. A little pressure. Good. Face down again. And now face me on your side. Semester is almost over for you though, right?
Yeah, getting there. It's like the home stretch.
Yes. So exciting. So we're gonna get her low back now. So right here. Breath breath in, easy out. Let that roll. Beautiful. And she's good on the other side, so I'm only going to adjust that one side. Legs fully extended for me. And this maneuver is just a long axis distraction on the hip. Sometimes you get a little plus in that mortise talus joint. Loose. Beautiful. So stay on your back. We're going to do a little occipital muscle tension release. So that's getting less tight, but how does that feel for you?
It's good.
Is it still tender though?
Yeah.
More here, more here.
The left side more.
So right now I'm just palpating our suboccipitals. Very common where people have migraines or cervicogenic headaches as well. These are always going to be tight. So I'm pulling up with my fingers, and then you're going to look up with your eyeballs towards me, and then relax. Is that pressure okay? And up again, and back down. Nice. Now we're going to adjust her. Let that fall right here. That's a really good one today.
Yeah.
And then a little lower right here. Not as big. Good. Alright. So I'm going to bring you up.
Okay.
We're going to finish with the zipper. So that's the one where I come behind you and I'll lift you up that way.
Okay.
So let's face them.
Okay.
Face this way. Arms out like this, wide stance with your feet. My arms are going to be coming through. Your hands interlocked on top of mine. Elbows in, head down. Big breath in. Keep the tension with your elbows. Fall back. There you go.
Okay.
How'd that feel?
Good.
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 So thank you guys so much for watching. If you have any questions about migraines or just in general, just type them down below, and we'll see you next time.
Bye.